Okay, hello everybody. This is Dr. Kachepa from Inwood Dental. In this case, I want to talk about dental implants and dental bridges like this here. A lot of times here in my clinic at Inwood Dental, we get questions about dental implants and bridges. Typically, patients are asking me, why would I want to get a bridge like this when I can just get an implant that fixes one tooth here? So in this particular case, we have a patient, and I'm going to remove this crown here. Okay, we have a patient that's missing this tooth here, and then this is the abutment. I'm going to remove that as well. Okay, if I can do it without okay, here we go. That's coming off, and that's the little abutment, we call them in the dental field. And okay, that's a little abutment. Okay, now yeah, so in this particular case we have this patient. Assume that this implant is not in there. We have this patient that is missing this tooth here. They had this tooth extracted at some particular point in time, or it just never grew in. When they were growing up, it just never came in. So now the options are going to be to place an implant like this in the bone, or to do a bridge like this, which would replace that and fix that space that they're missing the tooth. Now with the bridge, you have to shave down this tooth here and this tooth here, and then make a 3-unit bridge to fix this space here. And I'm going to demonstrate that, how that works. I'm going to take this crown off, and then I'm going to take this crown off, and let's see here. Okay, I'm going to take this crown off and put this bridge on there like that. And that's how a bridge works. A bridge, you have to shave down the opposite teeth. You have to shave down this tooth, and you have to shave down that tooth, and then so this implant is not in there, and it's an empty, and then you have this ponic in the middle, and that fixes that particular space. Now we get a lot of questions from a lot of patients that say, well, that doesn't make sense. Why would I want to shave down this good tooth, or this tooth here, and shave down this tooth here, when I can just do a implant, when I can just fix this one area here, like I had it earlier. I'm gonna reconstruct this again. I'm gonna put this back in there, just like this. Okay, let's see, we got that in there. Let's put this back in there, and let's put this here, and let's put that implant there. So a lot of people say, yeah, why do I want to mess with this tooth here and that tooth here when I can just place an implant here and not have to deal with these other ones? Well, there are cases in which doing a bridge like this one here and messing with this tooth here and this tooth here is a better option than just doing this. Those cases typically involve patients that have some kind of health conditions. So if you're diabetic, for example, placing an implant here, the implant is not going to work, because the bone typically is not going to osseointegrate with the implant, and the implant is just going to fail. If you drink a lot if you're alcoholic, for example, placing an implant, just doing an implant here, likely the implant is not going to work. Could it work? It could, but the chances of that happening are slim. If you smoke a lot, placing an implant like this is not going to work. So in that case, it makes sense that you go ahead and shave this tooth down and shave this tooth down, and then you make a bridge here. Another case in which it might be better to do a bridge instead of an implant is if the patient doesn't have enough bone around here. Let's say when they were taking out this tooth, a lot of the bone was removed. In that particular case, you would need either a bone graft done here, and then waiting a long period of time for that bone to rebuild itself here, and then placing an implant. So when you add all of that up, then it ends up costing a lot of money for the patients, and it takes a long time as well. It can take up to 6 months, up to a year sometimes, to be able to get that. So there are cases in which really making a bridge is a much better option for patients. I've seen a bridge like this last a very long time, and I've seen implants like this last a long time. They should both last, if they're done correctly and good oral hygiene, they could last up to a lifetime. But some of that depends on patient behavior, brushing, flossing, what kind of material is used to make these prostheses. But a bridge is just as good of an option. I'm going to put it back on here again so I can demonstrate how a bridge goes on there. The little thing I'm removing right now is called the abutment, the crown abutment. And then I'm going to remove this crown from this tooth and put the bridge back in there like that. Now the bridge doesn't come in and out. Neither one of these comes in and out. So when you put a bridge in there, it's cemented in there. Now you have to get underneath here and clean it out. You have to pass floss through here, and you have to clean it out. But you have to, and then with the implant, you can floss in between here. And another big major difference, again, what I said, is the time that is involved to be able to replace this missing tooth. You can get a bridge made within 2 weeks, 3 weeks. That can be done. An implant typically is going to take 6 months, because you have to place the implant. This has to heal, and then you have to come back and put the crown on top of that. So there's some patients that are just anxious. If they have like a wedding that's coming up within a month, and they're trying to look good for that wedding, they don't want to wait that long before they get a tooth there. So some patients will opt to have a bridge made because they can get it much faster. So there are many different factors that you wanna do that. And normally we recommend that so if you're missing a tooth like this, and some patients will ask, well, what if I just want to leave this space empty? I don't have to do anything. Well, you can do that, but typically we don't recommend you do that, because this space here between this and this, it collapses over time. If there's nothing there, because the forces from here, so this space there collapses. It shrinks over time. Then it ends up compromising this tooth here and compromising this tooth here, and you may end up losing this tooth and that tooth there, and then needing a partial denture here, or not having anything to eat with on this side of your mouth. And then not just not having anything to eat with, but when you smile, sometimes you'll be able to see these areas. That's why typically we recommend that you get these areas fixed, and you either get it fixed with a bridge or an implant. And whichever option you go with, you have to sometimes do your own homework as a patient and decide which one you want to go with. If I have patients here in my clinic that are looking for a bridge or an implant, typically the key thing I'll look for is the general health of the patient. Do they smoke? Do they drink? Or are they diabetic? If they have, big underlying health conditions, then I'm going to recommend a bridge, and if they can afford it as well. If they don't have big underlying health conditions and they can afford it, then I'm going to recommend an implant. But whichever one you go with, as far as longevity, either one, at least in my practice, what I've seen is that they both last a long time. They're both good options. And they both work. Another scenario in which you may want to actually think about doing a bridge is if there's a big cavity in this tooth and there's a big cavity in this tooth, it's better to do an implant, because with the bridge you're fixing this whole area with one prosthesis here, whereas if you just did one implant here, you would still have this cavity or fracture on this tooth and a cavity and a fracture on this tooth, so you still have to fix this, so it ends up costing a lot more. So that's another option in which you would want to do a bridge if you have a big fracture or cavity on this tooth and then this tooth as well. So anyways, I hope I answered your questions. Again, why should you do a bridge instead of an implant? If you are diabetic, you're a smoker, you drink a lot, or if this tooth here is has a big cavity or a fracture in it, and this tooth has a big cavity and a fracture in it, a bridge would be a better option than an implant. You would want an implant given that a lot of conditions are correct here. If you have enough bone here, you're a healthy patient, you can afford the price for an implant, then an implant is going to be a good option for you. So anyways, if you're looking for any of these services, you can give our office here in Inwood Dental a call. We would love to do one for you. We've done many of these and with great outcomes. And we would also appreciate if you could subscribe to our YouTube channel and share about our practice, because we love treating people and we love educating people so that they understand their options for their mouths. And remember to always floss and brush, because a lot of times if this was extracted due to cavity, you can prevent that. So always remember to brush and floss. Okay, thanks. Bye. This is Dr. Kachepa again. Thanks. Bye.